Just set up here nicely. Okay, so hello everyone and welcome. My name is Zoe, and just a little bit about me for context before we jump into the topic. I have worked in a clinical capacity with clients for about 13 years now. So I'm a registered mental health social worker, originally from Melbourne, Australia. And I lived in Southeast Asia for 5 years, where I was divided between Thailand, where I was working as a trauma therapist alongside of psychiatrists and medical doctors in an inpatient treatment setting. I was affiliated with that particular treatment setting for a number of years after I had left Thailand, and I was conducting my research in Cambodia in the area of trauma and resilience. My research looked at resilience in the context of trafficking and modern-day slavery. And I have been working internationally with organizations and with, I call them clients. And I understand I'm talking to medical. A lot of you will use the term patients, but I work with clients internationally. And I'd like to start by asking everyone to perhaps type into the chat box where you're dialing in from today, because I'd love this to be an active session, and I'd love some comments from the group. So I know that there's many countries represented. Can we get some comments into the chat? Because I know that I'm going to be talking to a diverse group of individuals, and some of you will be coming with different lived experiences. But I hope this topic is really helpful for all of us in the group, whether we're students, medical doctors, working in different fields, because burnout is particularly relevant. One little step into the research, just in a general sense around burnout, you start to see a lot coming from the field of medical. So whether that is in rural settings or emergency services, we start to see a lot of different studies that have been done because it is so prevalent globally, but also specifically in the area of healthcare. So we also have nurses and emergency services and people who are at the front line of caring and, helping. It's a helping profession. And that comes with it certain challenges that other professions don't face. So let's jump into the topic. First of all, with a bit of a definition. Sorry, I just need to turn on the air conditioning, otherwise I'm going to melt under my lights. So I've got one person who said Pakistan. Where is everyone else dialing in from? Hello, Pakistan. I know there'll be lots of countries. Do let me know in the chat. So this topic, as it is called, burnout, these three kind of key areas really speak to how burnout presents. I've worked with many clients that have experienced burnout, and some of the comments I have had are, it feels like I am numb. I am watching myself walk through my day with no connection to anyone or anything around me. I had one client almost describe it as an out-of-body experience, like he was looking down on himself, moving through the day, but he wasn't present. And what I'm talking about here falls under that depersonalization category, but it's often coupled with exhaustion that is not directly related to lack of sleep. But what we also might find is that detachment also comes into our work. And there was a time when I was working in that inpatient treatment setting that I mentioned, where I started to see a significant shift, and I believe I was edging towards burnout. And I was still doing my job properly, but I was just a lot less engaged. And I also noticed that I'm a relatively emotional person. So when you tell me something sad, I'm going to connect to that. I might not feel the same level of sadness as what a client or what you are experiencing, but I don't have times where I feel nothing. And this particular time, I remember feeling nothing. There was no emotion, and that was unusual for me. So some of you might relate to that, because there are a lot of different factors that contribute to burnout, but particularly in a healthcare setting. Many of you will be experiencing long hours and high stress. And we see that these are the two biggest factors. But layered onto that, you have the emotional demands. Depending on what you are being exposed to on a daily basis. If it's human suffering, there is a possibility that you absorb some of that suffering or you detach in order to keep yourself safe in those times. And I've always found it really interesting about human nature as to what we might, I use the expression lands, what lands with me. It's not necessarily the worst trauma story I've ever heard in my life, but it might be something I really relate to, or something that's happened to a family member, or there's different times where I've walked away from a interaction with a client where it's landed, and I can recognize that. A lot of these other points also talk to our workplace environment. If we feel like we are a clog in a well-oiled machine, or we don't have that autonomy, and autonomy is a perception. It's like control. And some of you will be thinking, no, I have a very large level of autonomy in my role. I have those choices. And that bodes very well with resilience. The more in control we feel of our life, our work, and our experiences, the better that bodes with resilience. But that's not always possible, particularly in emergency settings. Also, sleep disruptions. We find that, and as I'm talking to healthcare, physical interlinks with mental health. We cannot have one without the other. So what might start out with stress and cognitive overload then dips into sleep disturbances, appetite changes, everything from elevated heart rate and cortisol levels in the body. So we see this feeding between the physical and the emotional sides of our health and our mental health as well. So a few slides just on the neuroscience of this. And what I've always found fascinating about human behavior is how our thought process essentially is our truth. And I know this doesn't sound like neuroscience. It sounds a lot like, I'm smiling when I say this, but sociologists, how they say truth is a construction. And I love that because it's very much about what our brain tells us, which is pre-established, essentially. In my first year of psychology, they taught us a great expression: neurons that fire together wire together. So our experiences of the world and our experiences of stress might be profoundly different to that of one of our colleagues. We are not carbon copies of ourselves, even though there's some neuroscience that suggests, given enough stress, these are the kinds of impacts that it's going to have. And I know that I have experienced cognitive confusion, and some of you might also relate when you have been working incredibly long hours, or you've had a very high level of stress in your life and you start to feel really fuzzy. And I remember in 2020, I was finishing my PhD, and given the nature of the work that I was doing and the state of the world, it got very, very busy. I was living in a remote region in Cambodia, so I wasn't as connected to my circle. And I was feeling quite isolated and overwhelmed, and just push. This was my self-talk. I'm just going to push through. I'm just going to manage this, and I can do this. And I was doing everything right, the exercise and the meditation and all of these strategies that I know so well and that I recommend. But I was still finding I'd sit down to rewrite a paragraph and I'd spend 20 minutes rewriting it. I'd get a cup of tea, come back and realize I'd made it worse. My brain quite simply wasn't working. And what happens with that ability to emotionally reason and understand long-term consequences, this is centered in our prefrontal cortex. So when our amygdala takes over, essentially, if the stress is heightened enough, we lose our capability to make informed decisions. So whether it's fuzzy or exhaustion, fuzzy is not the clinical term, but this is what's happening in our brain. Our memories can be stored differently. And I've always found that interesting, to use a trauma example, when someone is recounting their truth as they experienced it to be, how profoundly different that can be from someone else who might have witnessed a similar event. And how we then go and store memories can also be affected depending on the impact of the stressor. And cortisol, adrenaline, and epinephrine floods the system during peak times of stress, and that can dysregulate just about everything, particularly if it's over the long term. And what I always found interesting is how that interacts then with dopamine. And I'd like you all to reflect on that question about your fulfillment in what you do right now. And when there have been times in your life, and a lot of you will have had those times where you are running on empty, how joyful do we feel about going to work? So something that when we're feeling good and we're feeling fit and we're healthy and we're happy and we come to work and we can take on the world, and then other weeks where it just seems completely overwhelming and we're dragging our feet through the course of the day. This is directly related to our overall, our interaction with dopamine. It reduces our reward responses. So what might have brought us a deep sense of satisfaction begins to feel a lot like nothing or resentment. And I wanted to include a slide on compassion fatigue because this can be very relevant for healthcare. When you are at the front line of human suffering, compassion fatigue can occur. And when you look at the symptoms that are on these slides, you'll see it's very similar to burnout in how it presents. And I'll talk on the next slide about what some of those differences are. But the key difference between compassion fatigue and burnout is often external. So working long hours, high stress, we can be in a corporate role and burn out. But compassion fatigue speaks to that interaction with other people. So particularly in medical, is it long hours and is it the work that you're doing? My little brother, my nephew got very sick with leukemia, and they spent a lot of time in the hospital. And I remember him talking about his experiences of some of the most amazing medical staff that were a part of my nephew's journey in recovering from cancer. He's now 1 year clean of it, or clear of it, I should say. And it's still that waiting game, but my brother was so impacted by the medical professionals. And so for those of you that go to work, have those interactions and feel inspired, fantastic. But I sometimes think it's this line that we walk where sometimes we feel engaged and helpful, and we can empathize and we can be of assistance and be part of someone's recovery. But other times you're also there for all of the opposite of that, when there isn't that recovery and there's grief and there's loss and there's aggression with other family members. And some of you might have seen all kinds of human behavior that is really challenging, and that can take its toll. So what you're looking at here, from behavioral to cognitive symptoms, similar to burnout, but not quite the same. It's more where it stems from. So you can see here, compassion fatigue is emotional exhaustion and exposure to patient suffering. And I'm going to ask for some of you to reflect on that, because I'd love to hear some examples from the group. If any of you would like to share in the chat a little story or something that might have been really relevant for you, because I'd like you all to do a self-assessment check with me. I'm going to read out these 10 statements, and I'd like you all to consider how many of these pertain to me, and just keep a mental note of the number that apply to you. Number 1, do you feel emotionally drained after working with patients? 2, have you noticed a decline in your ability to empathize with those in your care? 3, do you experience intrusive thoughts or distressing relocations related to patient cases? 4, have you been avoiding certain patients or medical situations due to emotional discomfort? 5, do you feel a sense of detachment or numbness when interacting with patients? 6, have you ever felt overwhelmed or cynical about your work in recent weeks? 7, do you experience physical symptoms such as headache, fatigue, gastro-like symptoms related to work stress? 8, have you struggled with sleep disturbances, nightmares, or heightened anxiety related to your professional role? 9, do you find it increasingly difficult to recover emotionally after challenging patient encounters? And 10, have colleagues or loved ones expressed concern about changes in your mood or well-being? So hold on to the number of statements. So some of you might be in a lower risk category. And what we find is elements such as social connection. For those of you that are very well connected with your family, friends, colleagues, you feel that sense of belonging. Doesn't mean you will not burn out, but it certainly buffers stress. So some of you might have really good health practices in place as well that's contributing. Others of you, depending on your workload and what you're being exposed to on a daily basis, might be tipping into the 4 to 6 or perhaps 7. And there might be times where you have lent into a really high response. And so we're going to switch gears a little bit, but first I'd like to ask a question. Have you experienced symptoms of burnout or compassion fatigue? I'd love to hear some comments from the group in the chat. Would anyone like to share? Otherwise, you'll hear a lot about me as examples. So I mentioned the time when I was working in the inpatient treatment setting and then also in 2020. One of the reasons that I made a decision to mix up the work that I do, I work with Fortune 500 organizations, I work with clients that do not have a history of trauma. So I work with a diverse client load, and that is a direct correlation between my decision and how I structure my work and what has happened in the past, where I've had times where I was working with trauma for 10 hours a day, and this was too much. One of the areas that I also saw emerge was my worldview was shifting. How do I frame this? I didn't have a particularly rosy view of mankind. Let's just put it that way. When you're in the trenches with trauma and all you see is the hurt and the suffering and the pain, often caused by people that are supposed to protect that person or that child. And so I was hearing a lot of that, and that took its toll. So as a result, I have moved on from that, thankful for the experience and the knowledge and everything that I learned, but I balance that out. Now, I understand that that might not be possible in the work that you do. I mentioned autonomy. So that sense of control and autonomy, and for some of you to say, these are the hours, this is how I'm going to recover, this is what I want to do, I feel like I'm in control, is going to have a really big impact on then how you deal with stresses. But for those of you that are perhaps students early on in your career, you're not going to have that kind of control over your work life, maybe until later down the track, when you've had those times where you've almost burnt yourself into the ground. So if that's the case, what can we do? What are some helpful strategies that we are now going to discuss? So we did a very small self-assessment. There are varying assessments online, but I would strongly recommend is for you to have a reflection time structured into your day. And it might just be a couple of minutes at the end of the day that you sit there with a journal of sorts and just dot point. This is how I'm feeling. This is where in the body I experience this emotion, and anything that you're thinking about. And it might just be one line, because this is for you. It's not a long activity, but you get to see over the days, weeks, and months, and you can keep this going. It's also incredibly helpful for our brain. We can recognize what's occurring, but also I've found it interesting how the same neural networks light up for emotional pain as it does for physical pain in the brain. And so if I put my hand in a fire and get burnt, neurons fire where if I experience emotional pain, and think about the language we use to describe emotional pain. They hurt my feelings. It broke my heart. It sounds really physical. And there's elements of that in all languages. And I feel like this is the reason why. So knowing, and I know I sound like a therapist, right? When I ask you also, how does that make you feel? But there's a reason why a lot of therapists are, they're intent on asking clients that question. And you can do that as a self-assessment. And we're going to talk about some different kinds of strategies. And some of you will have some mindfulness meditation practices. You might have some apps that you like to listen to, or downloading things on YouTube. There's no right or wrong way of doing this. It's what is going to work for you. You might like to listen to the sounds of the rainforest for 5 minutes in between patients, or you might like to start the day with a 20-minute meditation. It depends on your time frame, your family structure. We'll talk about breathing in a moment, but these are the micro-recovery moments. Some of you, it might be movement. If you've been sitting down for longer periods, getting up and moving the body. When I work from home, which is frequently, I'm largely international, I will roll out my yoga mat and do some stretches in between lots of online sessions, because I find that I need to refresh my brain. So that's one of my micro-recovery moments. And I would suggest trying a whole lot of different strategies. And I'd like to start with breath work. Cyclic breathing, or the physiological sigh, has been getting a bit of focus from Stanford University in particular. And some of you will be familiar with Dr. Andrew Huberman. He has a wonderful podcast. He talks about the physiological sigh. We also see this technique being used in Yoga Nidra. And Yoga Nidra, for those of you who are not familiar, India, birthplace of Yoga Nidra, and it's a lying down yoga. So it's not movement, and it focuses on different areas of the body, and it incorporates different breathing techniques as well. But I'd like you all to try this with me while you're sitting here. 2 short inhales. So we inhale through our nose, and then another inhale, completely filling your lungs up with air through the nose, and then sigh it out. And this is called the physiological sigh, and it's been shown to be, by Stanford, one of the best breathing techniques that we can utilize. Box breathing, I think, is particularly useful for anxiety. So visualize a box, inhale counting for 4, hold your breath counting for 4, exhale counting for 4, hold your breath counting for 4. It's a bit more uncomfortable way of breathing, and it puts a bit of pressure on the lungs, which can be useful in sort of releasing some of the tension that we might be experiencing in the top part of our body, particularly for anxiety. One of my therapist friends, she works with special forces in her country, and special forces learn box breathing. And then our last one here is really based on the principle of exhaling for longer than we inhale. Because I like to do this, to try this out when I'm walking. And sometimes if my heart rate is elevated, I've gone up a little hill, I just inhale and exhale for longer, and it sends a signal. So it slows down my heart rate and my breathing. As long as I'm not trying to battle it up the hill and breathe like this at the same time, my heart rate drops quite fast if I'm exhaling for longer. So you can try all 3, and one little trip to Google will give you a wealth of different breathing activities, and these can be done in very short spans of time alongside of our social connection. And I love the research that was done by Harvard University on happiness. They have the longest running happiness study of its kind, and they found that, well, they asked start from the start. They asked a group of young Harvard men, what do you want in life? What would make you happy? Being young Harvard men, they said, money, power, fame, prestige, more money. And Harvard has tracked these men through the course of their life, and what they've found is huge volumes of money don't make us happy. Social connections do. The ones that were the most socially connected reported higher levels of happiness, but they also had better physical health outcomes. And that's why I know this is not groundbreaking information for a lot of you. It is directly related. The Harvard men that were in high conflict relationships or were socially isolated had lower levels of self-reported happiness, but they also had poorer physical health outcomes. Diabetes, heart disease, and high blood pressure were higher with that group. So we see how social connections is not just for our mental and social well-being, it's for our physical well-being as well. And if we are in the medical field or healthcare and being presented with these additional stresses that might not be there in other fields, this area is really important. Who's on your team? Who can you talk to? And first point here around physical health strategies. We know this. This is not groundbreaking, but it's interesting how many people, I'll speak from my field, therapists that I know that will talk to clients about this, but not necessarily follow this. And I've also met medical doctors in my time that don't necessarily take very good physical care of themselves. And we know that nutrition, sleep, and exercise really is the baseline for our emotional well-being as well. So the more we are talking about these kinds of things in the workplace, talking to your colleagues, asking them how you are coping with the hours, the level of stress, what are breathing techniques that you do, how do you relax at the end of the day? When you're asking those questions and you're talking about it, you're also normalizing stress. Because I find in medical, sometimes what I've seen is because of those long hours and patient-centered approaches, that has been normalized. And I'm not saying that we should necessarily push back on that, but I think we need to acknowledge the impact that that then has. And so being able to turn to a colleague and say, I'm having a really hard day today. I've just heard about this, this, and this, and I found this to be really distressing. And naming that, talking about it. Now, that colleague might not have the answers, and that's okay. Because I know in my field, when someone talks to me, sometimes they don't need strategies right away. We get to strategies for sure, but they want to be heard. And we all have the capacity to do that with one another by reaching out with empathy, compassion, kindness, talking to our colleagues and building that environment that's psychologically safe. And that will be a stress management strategy in and of itself. And so some of you might be participating in holistic activities. I found that when I was working in that inpatient treatment setting in Thailand, my understanding of holistic activities very much deepened. I was working with trauma clients, and some of whom had lost the ability to emotionally regulate. So they would see something or hear something sad in a group and would cry or sob, and this is obviously not helpful for them or others in the group. So I would have them work with a holistic team, and they would do trauma yoga and walking meditation on the grass, feeling the grass on their feet. They'd learn grounding exercises, which is just a fancy way of saying be in the body and breathe. And all of these techniques coming together within a month, it was like I was talking to a brand new person. That it was incredible the impact that that would have. And so we never dismiss this as part of our toolbox for health and wellbeing strategies. All right, so that brings me to the end of the session. I wrote an article as well in conjunction with the conference presentation on navigating burnout. So you can find this on ResearchGate, Google me, and that will come up along with a whole lot of other articles that I've written in the area of trauma and also psychological well-being. All right. So on that note, is there any questions or comments? Anything that the group would like to add? Anything that you'd like to ask? Please feel free to do so. And I know we've got a terrific lineup of speakers coming up, and I look forward to hearing from the rest of you. So on that note, if there's no questions, thank you everyone for listening.